Hello to our St. Mary's community and families. I am Dr. Cami Jo Tice-Heroff, and I am a family nurse practitioner and your director of health. I want to take a few minutes to reiterate what we are focusing on. Our primary goal in this year has been to keep our doors open, and that means our classrooms on campus. So I want to extend a genuine word of thanks and gratitude for all that you are doing to remain flexible and follow our safety protocols. It really does take an entire community to keep our doors open. St. Mary's has been committed to making data-driven decisions. We look at the latest available information, and so what I'd like to do is take a minute and show you what some of the information looks like that we're reviewing. Here you can see the daily new confirmed cases in Texas. This is for the entire state, and we can see very broadly that earlier in the year there was not a lot of testing available, if any, so rates were basically non-existent. However, with the increase in the availability of testing, we have seen trends go upward. They have come down, but then they have rapidly increased again here as we move towards December. I'd like to take a moment to look at Gregg County. I'm going to point out some counties that we look at because we serve these counties, meaning we have students, we have faculty that come from these counties. So again, here in Gregg County, we had some spikes over the summer, things started coming down and they're going back up again. Let's take a look at Smith County. Smith County, again, had that summer spike, started coming down, went up again, and now again, we're seeing here at the end of October and in the middle of November, these rates are increasing, this daily new confirmed cases. We also look at Upshur County. Upshur County has had some activity in late August where rates went up. The scale has changed here, but again, we look at the local trends and that tells us, it informs us how rapidly transmission of the virus is increasing in the community. So we saw things go up. They appear to be coming down. Upshur County, we are watching you. We want to make sure that you continue to go down. Let's look at Harrison County. Harrison County had some spikes throughout the spring and the summer. And again, they've started going up again. We're watching that very closely. Now, Panola County seems to be in a plateau. We'll continue to watch, but we're not overly concerned there. And then we also monitor Rusk County. Again, things appear to be fairly controlled in that county. So I want to share some information from the Northeast Texas Public Health District. This is where Gregg County reports. And we saw that in the last part of October, first part of November, we were in this moderate risk category. And Gregg County had a rise in cases. Smith appeared to have a decrease in cases. As we went into November, we can see that now both Gregg County and Smith County are in a substantial risk category. And as of last week, we continue to be. So we've confirmed with the local health department and our contacts there, hospitalizations are up, ER visits are up, and local primary care providers are maxed out. We're seeing an increase in visits from our established patients and our new patients, many of whom have symptoms, whether it's COVID or the flu, and in some cases we've seen where folks have had both. So we're rapidly utilizing those resources, and every community has to be very judicious in how it leverages support and resources for those in need. We know that there is a lot that we can do. We can make informed decisions to reduce our chances of transmission. So following protocols, we do know that social distancing at least 6 feet, along with both people wearing masks or facial coverings, this is the very lowest risk. Anytime we are outside our household, when we're around people, maybe they come over to our house, but they are not primary residents of our household, we want to practice these safety protocols and keep that distance, and again, wearing our facial coverings. At St. Mary's, we continue to inform and update our processes and our protocols. We have a community health safety plan, and if you go to our website, you can look under important information. When you do, you will notice that we have this community health safety plan posted. You can look at a copy of it here. I just briefly want to mention we've updated our definition of close contact to be congruent with the CDC. And we have also added in details on our safety protocols where we disinfect between classrooms who use our gym. We disinfect between classroom cohorts that use our cafeteria. And we just go above and beyond to make sure folks are safe throughout our building. We also have put together this high risk assessment. We know that the highest level of risk for anyone is when someone in your household has any of these criteria. Please do not come to campus if anyone in your household has these criteria. Do not report for work. Do not send your students. Please call ahead. Let us have a conversation with you where we can ask questions. We will maintain your privacy, but we want to make sure that you are safe and that we keep others safe. So I'm going to back up here just a bit and show you what the beginning of this looks like. This is an optional inventory. And for those who fill it out, it helps us tremendously. Again, we will keep your information confidential. Your household name, your phone number, we just ask that you fill that in and let us know among your students, and if you are a household with a teacher or a staff member, what grades do you come in contact with? What grades are your students in? If you qualify for these low-risk activities, consider yourself medically cleared to return to the St. Mary's campus after Thanksgiving break. We're happy to have you and we appreciate your diligence. Many people will fall into this moderate risk category. And as you look this over, I want you to make a decision before coming back to school. Can you safely be assured that all of those in your household have been able to maintain hand hygiene, social distancing, and facial coverings as you have been out in the community around people that you do not live with? If you have maintained these practices, we welcome you back, but please err on the side of caution. We ask you to make a decision to protect yourself and other people. This high risk category, again, we know some families will need to use this high risk category, and that's fine. We support you in your personal and family decision making, but we do ask that you observe a 5-day quarantine. So the week after Thanksgiving break, please plan on getting set up to do distance learning. Or if you are a teacher or a staff member, we ask that you plan ahead for a substitute with plenty of lesson plans. We want to keep all of the learning activities going just as we have all along. And again, if you are in this category, again, looking at these criteria, this is a situation where you are not able to regularly maintain your hand hygiene, your social distancing, and your facial coverings. It also assumes that perhaps you've been around strangers. So in the moderate risk category, this is looking at people that you know and that you stay in contact with. If you're around family and you stay in contact with them in the days following your gathering, please reach out and ask, is anybody sick? Anybody have a positive test? If that is the case, we can usually help those folks reach out to their primary care provider and more accurately assess their level of risk. So again, we're happy to work with you. Please let us know ahead of time. The last thing I want to share with you is COVID testing available on campus. We are not testing everyone. We are being very careful to use our resources. They are limited, but this is the Abbott Laboratories Binax Now test provided by the state and federal government. We will always ask for your consent before we administer a test, and we will not give a test to everyone. We're really trying to monitor high-risk situations and only do this on an as-needed basis. So again, I'd like to share with you that we feel like we're prepared. We ask and plead with all of our families to make the best decisions for yourself and your household to reduce the risk of transmission across the community, and especially as you prepare to come back to school. Some have asked if I myself or if one of my students is in close contact with someone who is diagnosed with COVID, how will I find out? Will you tell me? Please know that we will call you. We will call you, we will have a conversation, and we will help you make decisions and make sure that you have follow-up support if it's necessary for you or your student to be tested. We did have one case on campus. We rapidly responded. We isolated the person, and anyone in close contact we sent home and asked them to isolate and follow up with their primary care provider to make sure that they could get testing and be supported. Some have asked, will we ever close down a classroom? Yes, we will, and we have considered this all along. This is not something we want to do. We want to keep our doors open. However, if the risk is there, we will close down a classroom or a cohort, which means if we had a positive case in our middle school, we would try to only isolate and close down the classroom, but in the worst case scenario, that might mean that we close down just the middle school, allowing our elementary school and our high school to remain open. So with cohorting, we can try to keep most of the campus open and have folks continuing to do their normal educational activities. Thank you for your time. I appreciate everything that you are doing. It does help us keep our risk low and keep things safer. If you have any questions, please reach out. We wish you all the best in your holiday season. God bless you all.